Okay, class, we're going to start the muscles, give you a brief introduction to muscles, and then go into specific muscles of the head and neck. Now, skeletal muscles are responsible for movement of the body and all its joints. Muscle contraction produces the force that causes the joints to move. Muscles also provide protection, provide dynamic stability of joints, contribute to posture and support, produce a major portion of the total body heat. Now remember, joint ligaments provide static stability, but muscles provide dynamic stability. Yes, this was back in the days, yes. Now, let's start off with just looking at some of these muscles here. You should be familiar with some of them. You should be able to point them out on a regular human just as much as a diagram. So pectoralis major, okay, deltoid, diplasma, trapezius, deltoid, biceps, triceps, rectus abdominis, okay, these are the lats, vastus medialis, rectus femoris, vastus lateralis. Okay. So if you look at the face, that is what we're going to concentrate on today. We can't really see it on him too well, but there's the frontalis, but then going from back to front, it combines as the occipital frontalis. You have the orbicularis oculi, the masseter, orbicularis oris, sternocleidomastoid. Okay. Pectoralis minor would be deep to that. Serratus anterior, call it the Bruce Lee muscle. Brachialis. Biceps. Brachioradialis, goes from the arm to the radius, brachioradialis. Okay. You have the adductor longus. You have the sartorius, which is not, you can see it right there, yeah. Sartorius right there. Okay. Then you have tibialis anterior, gastroc, soleus. So this guy's pretty cut. Now, the back, you got the occipitalis, but again, there's a muscle that goes from occipital frontalis, so we call it the occipital frontalis. You got the traps, infraspinatus, teres minor. Okay. Here's your lats. Okay. Rhomboid major, rhomboid minor, deltoids, triceps, glutes. You got the hamstrings in here, semimembranosus. Okay, biceps femoris. This is just an introduction. We're going to go just do the head and neck today, and then we'll get more specific to gastroc and soleus. So there's over 600 skeletal muscles that comprise approximately 40 to 50% of the body weight. 215 pairs of skeletal muscles usually work in cooperation with each other to perform opposite actions at the joints they cross. Aggregate muscle action means muscles work in groups rather than independently to achieve a given joint motion. So when you go to the gym and just individually work a muscle, such as the quads or on a machine, it's fine to do for aesthetics, but functionally for sports performance, it doesn't do us any good. Everything has to work together, such as aggregate. So your hams, your quads, your glutes, they all have to work in unison for us to get the best bang for our buck. So again, doing compound movements such as deadlifts, squats, lunges is much more effective for sports performance than going to the gym and doing individual machines. So let's see why or how these muscles are named, because again, just like the bones, there's a reason. So muscles are usually named based on their visual appearance, anatomical location, function, the shape. It could be deltoid shape, rhomboid shape, the size, gluteus maximus, teres minor. So instead of just memorizing the muscle, memorize the name of it and why it's named or why it looks the way it looks, and you'll be easier you'll have an easier time remembering this stuff. The number of divisions, remember triceps brachii, that means it has 3 heads. Biceps brachii has 2 heads, brachii meaning arms, so triceps, 3 heads in the arm, biceps brachii, 2 heads in the arm. The direction of the fibers, external abdominal oblique. Location, rectus femoris, palmaris longus. Okay, so femoris meaning femur, rectus meaning straight, so a muscle that's straight on the femur, palmaris longus. Points of attachment, they're named, so coraco from the coracoid process, brachialis, okay, to the arm. Extensor hallucis longus, so it extends the big toe and it's long. Flexor digitorum, it flexes the digitorum, the digits. Okay, what's the action? Erector spinae, it supinates, the supinator, and the extensor digiti minimi extends the little pinky. So muscles have all sorts of nomenclature. They can be named for divisions, direction, location, action, action shape, pronator, and the quadratus. So this quad-shaped muscle pronates. Now there's different types of muscles. So there's a fusiform. So an example of a fusiform would be the biceps brachii. Example of parallel will be the rectus abdominis. Example of the pectoralis major will be triangular. Example of unipennate is palmaris interossei. Example of bipennate is rectus femoris. Example of multipennate is the deltoid. Example of circular is orbicularis oculi. So here's the parallel flat muscles. The flat muscles are usually thin and broad, originating from broad fibrous sheet like aponeurosis. Allows them to spread their forces over a broad area. So that would be the rectus and the external obliques. Okay, there's our thumb guy, Hrithik Roshan, and then here's another. He's probably one of the highest paid actors in India, and actually I think in the top 10 in the world, Shah Rukh Khan. So this guy makes, I don't know if you guys have heard of the song Be Like Shah Rukh Khan. All right, I'm gonna have to show you that. That's a good one. All right, parallel fusiform muscles, tendon, belly, tendon. Fusiform muscles, spindle-shaped with a central belly that tapers to tendons on each end. Can focus their power on small bony targets, and brachialis and the biceps brachii. So that's the parallel fusiform. Okay, and that's the biceps. Now you have triangular muscles, which are also known as radiate muscles. Also described sometimes as being triangular, fan-shaped, or convergent. So radiate and triangular are the same. They have combined arrangement of flat and fusiform. Originate on the broad aponeurosis and converge into a tendon. So pectoralis major and traps are examples of this. So when you study these, I want you to know what's the category, right? Is it a flat? It's a parallel flat. And what's an example? So here there would be fusiform, example would be biceps. Triangular radiate, example would be pectoralis major. Now you have also parallel sphincter muscles or circular muscles, technically endless strap muscles, surround openings and function to close them upon contraction. So the orbicularis oris and orbicularis oculi are examples. Alright, so pennate muscles, so we talked about parallel sphincter, parallel radiate, parallel fusiform, parallel flat. But now you go into the pennate, and so let's go into unipennate first. Fibers run obliquely from a tendon on one side only. That's the biceps femoris, extensor digitorum longus, or tibialis posterior. Now you have bipennate. Fibers run obliquely on both sides from a central tendon. So example would be the rectus femoris. So the unipennate and the bipennate, they're actually pretty strong. So they produce the strongest contractions. Those are great quiz questions right there. They produce the strongest contractions. Now multipennate have several tendons with fibers running diagonally between them, and those are your deltoids. So muscle groups and compartments. Compartments are spaces enclosed by fascia called the intermuscular septa. Now each compartment, one or more functionally related muscles, nerves, and blood vessels, Upper limbs, you have anterior and posterior compartments, and lower limbs, anterior, posterior, medial, and lateral compartments. And the reason these compartments are there is to protect the body. So if one compartment is injured, then it doesn't translate into the rest of the body. But that can be dangerous as well, because that can lead to compartmental syndrome, and that is very dangerous. So here's the tibia, here's the fibula, here's the arteries and veins, here's the intermuscular septa. So the way that you can get compartmental syndrome is usually trauma, or it could be from surgery. Perfect example is my college roommate. We were playing basketball at the gym, and he got kneed in the thigh. And when he got kneed in the thigh, he's like, nothing of it. He thought it would be a bruise, right? So this is the difference between compartmental syndrome and a bruise. But when we got back to the dorm, he just felt like numbness, tingling, severe pain, and we're like, okay, this is not right. So we took him to the emergency room, and good thing we took him there. They had to do a emergency fasciotomy, or otherwise he would have lost his leg. So basically he had internal bleeding, basically, but severe. So what happened is one of these blood vessels had broken, but then there was nowhere for it to go. So it just kept expanding and expanding and expanding. So that was a pretty severe trauma. Now, a simple bruise is going to be superficial. You're not going to see a bruise with compartmental syndrome. You're just going to have severe pain, severe discomfort, numbness and tingling, which is what you would not get with a bruise. So unfortunately, this is one of the things that is the cure for that. This is not his leg, but compartmental syndrome, this is the lateral cruise, is a life-threatening condition resulting from an injury. There is insufficient blood supply to muscles and nerves, shutting off the delivery of oxygen and nutrients, resulting in a rise in the internal pressure within the compartment. Symptoms include tingling, numbness, paresthesia, and a decreased pulse. Okay, so you would not get any of this with a bruise. This is serious stuff. This is life-threatening. Insufficient blood supply to the muscles because the blood supply was damaged. Here's what's similar to my college roommates. This is basically what they did. He's got a big old scar right there, and it looks exactly like that. That's what they did. But yeah, that's compartmental syndrome. Nothing to mess around with. If athlete gets hit in the arm, gets hit, kicked in the thigh, and they complain of severe tingling, numbness, pain, you don't start feeling a pulse. You get them to the emergency room right away, or else they could lose their leg. All right. Now, you seek immediate help for symptoms: a deep aching pain in the arm or leg, which lasts for a few minutes. They have swelling and tightness. They have numbness, pins on needles, visible muscle bulging. I mean, this is way different than a bruise. Tingling or burning sensation, severe pain that increases with stretching, difficulty in moving the foot or foot drops, so the nerve damage. Now, what can cause this? Well, I mean, acute compartmental syndrome is caused by trauma usually, but chronic compartmental syndrome results from repetitive trauma or overuse. This could be from bone fractures, trauma such as a crush injury, a plaster cast or a tight bandage can cause this. Surgery, blood vessels, excessive exercise can cause this, burns, anabolic steroid use, and hemorrhage as well. So, nothing to play around with. When in doubt, get immediate help. So now muscle attachments, direct fleshy attachment. We have a close associated with bone. Indirect attachment, tendons attach muscle to bone, connects into the periosteum and matrix. You have the aponeurosis, which is a broad sheet of tendon, can attach to tissues other than bone, such as the dermis of skin. So muscles can attach directly, indirectly, through an aponeurosis, or at the skin. We briefly discussed this, but today we're actually going to start memorizing origins and insertions. So origin, structurally the proximal attachment of a muscle or the part that attaches closest to the midline or center of the body. Functionally and historically the least movable part. Okay, so these two heads of the biceps, this is the origin. So they don't usually move. The insertion is going to move. So the insertion now, structurally the distal attachment, or the part that attaches furthest from the midline. Functionally, historically, the most movable part. So if you look at this hamstring here, biceps femoris, this is the origin. So that's not going to move, but when you bend your knee, then this will move. So the insertion moves closer. The difference between intrinsic and extrinsic muscles. Intrinsic muscles are both origin insertion contained within a particular region. So intrinsic muscles of the hand, intrinsic muscles of the foot. Those are intrinsics. Extrinsics act upon a designated region but has its origin elsewhere. So this could be forearm muscles, hamstrings. They have two joint muscles. Okay. Now, coordinated groups of muscles. What's the action? Remember, muscles produce action and effect. They produce the movement and force. The prime mover is the agonist, produces main force of action. So let's say if I want to bend my elbow, my prime mover agonist is going to be my biceps. Synergist aids prime mover, may stabilize the joint. So the brachioradialis or the brachialis, those can help. Antagonist opposes prime mover. Antagonist pair act on opposite sides. So the triceps would be the agonist in this situation. And a fixator prevents bone movement. That can be at the scapula. Okay. So if we look at just some general, we're going to look at the muscles of the head and neck today. Tomorrow we'll look at, not tomorrow, but next session we'll look at the trunk and the back. Next week we'll look at the upper and lower extremities. So a lot of muscles that we need to memorize. Again, there's 600, but I only narrowed it down to about 50 or 60 of your top ones that you'll see or run into. So here's the occipital frontalis, which goes from anterior to posterior. You got the orbicularis ori, orbicularis oris, and the buccinator. Okay. Now these are the ones that you have to know. So again, occipital frontalis is from here to here. Origin is the superior nuchal line. Insertion is the gallia aponeurotic. Okay. Nerve supply is the cranial nerve 7. And what does it do? Raises the forehead, keeps this relatively intact. So occipital frontalis, superior nuchal line, inserts into the gallia aponeurotic. Now the temporalis is right here. Where does it originate? In the temporal lines. Inserts into the coronoid process. Okay. And innervated by cranial nerve 5. It's a thick fan-shaped muscle that closes the mouth and assists the jaw to move side to side to grind up food. So you remember that the coronoid process is on the mandible. Okay. And so this is why, remember, you want to know when we talk about the ulna, also there's a coronoid process on that. So you want to always make sure you're distinguishing which bone you're talking about. Remember, styloid process. There's a styloid process on the radius, styloid process on the ulna, styloid process on the temporal bone. Same thing with the coronoid process. There, it's on the mandible, but it's also on the ulna. So making sure that you're specific. Now, orbicularis oris, which is around the mouth, that's muscle fibers around the mouth. That's where it originates. Where does it insert? Mucous membranes of the lip. The nerves is cranial nerve 7. So look, cranial nerve 7 does orbicularis oris and occipital frontalis. So what does it do? The circular muscle around our mouth is the orbicularis oris, and this muscle brings our lips together so we can pucker up for a kiss. So next time you're like, hey honey, do you mind using your orbicularis oris? And she'll be like, excuse me? But basically that's just telling her that you want to give her a kiss. Okay, now the buccinator. I love saying buccinator or buccinator. Where does it originate? The lateral aspects of the maxilla and the mandible. Where does it insert? Into the orbicularis oris. So remember, muscles can insert into other muscles. And what does it do? We call it the trumpeter muscle. The buccinator's role is to puff out the cheeks and prevent food from passing to the outer surface of the teeth. It's got a pretty powerful buccinator. Now the plasma, if you look at that, that's right in here. Where does it originate? Fascia of the deltoid and the pectoralis muscles. So again, muscles can also originate on other muscles and fascia. Inserts on the mandible, skin of lower face, muscles at the corners of the mouth. So it's innervated by cranial nerve 7. What's it do? Its anterior portion, the thickest part of the muscle, which is right here, depresses the lower jaw. Also serves to draw down the lower lip and angle of the mouth in the expression of melancholy or surprise, of horror. Now women, unfortunately, sometimes they'll get these plasma cords that they don't like, so then they can do plastic surgery or BOTOX to help with that. So it goes from this to this, and we'll talk about botulism, BOTOX injections in just a little bit. Now the masseter, which is right there, that's from the zygomatic arch. Remember the zygomatic arch? Inserts on the lateral aspect of the mandibular ramus, right in here, and it's supplied by cranial nerve 5. As this runs from the cheekbone to the lower bone, brings the teeth back together up to grind, the masseter is in fact the strongest muscle in the human body by size. Okay, so how does Botox work? So every year millions of people try to look younger by taking injections of Botox, which is a prescription drug that gets rid of facial wrinkles by temporarily paralyzing muscles in the forehead. Although best known as a cosmetic procedure, Botox injections also have been approved by the FDA to treat uncontrolled blinking, blepharospasm, lazy eye, strabismus, involuntary muscle contractions in the neck, cervical dystonia, and acute underarm sweating. Yes, severe primary axillary hyperhidrosis. So Botox users might be surprised to learn that they're receiving minute injections of actually a bacterial neurotoxin called botulism. And it really is one of the most poisonous substances known on Earth. So fortunately, you're getting minute injections. Hopefully the person that is giving it to you is giving you minute injections. But exposure to large amounts of botulism, which can happen if you go to places that are not certified and you're trying to save a buck here and there, can cause paralytic, sometimes fatal disease called botulism. So last month, several Floridians were hospitalized with botulism after receiving injections of an anti-wrinkle treatment that authorities suspect were cheap, non-FDA approved imitations. So botulism toxin works by invading nerve cells, where it releases an enzyme that prevents the muscle contraction. So in recent years, scientists have determined that the enzyme binds to these specific proteins called snares, which form a complex in the synapse between the nerve and the muscle cells. And without the snares, nerves cannot release the chemical signals. Remember, we talked about acetylcholine and calcium that tell the muscles to contract, and therefore paralysis results. So these enzymes that are in specific proteins will limit the acetylcholine and the calcium interaction. So if you have forehead lines, you can get about 10 to 30 units here. Frown lines here, you can get 10 to 30. Owl lift, they call it, 2 to 5 units. Bunny or nasalis lines, if you have those, you can do 5 to 10. Masseter reduction, 30 to 40. A smile lift, corners of the mouth, 3 to 6 units. You want a dimpled chin, 2 to 6 units. And if you want vertical lip lines, you can get 2 to 7 units of that. Here she looks pretty good, and here, don't know what the hell happened here, but that's when people go crazy with their Botox and basically causes some pretty severe. I mean, she looks fine here. She looks great here. I don't know what the. Sometimes people just go overboard. Okay. Muscles of the head and neck. We got the sternocleidomastoid, clavicular head, medial 2/3 sternal head, manubrium. Okay. So it goes from here, inserts on the mastoid process. Nerve supply, cranial nerve 11. What does it do? It bilaterally flexes, and the right SCM will rotate to the left. Okay? And here's the trap. Here's the upper trap, middle trap, lower trap. Origin, upper external occipital protuberance to the nuchal line. That's the upper trap. The middle trap originates from the spinous processes of T7 to T4. I'm sorry, C7 to T4. And then the lower one will originate from T5 through T12. Inserts in the clavicle for the superior. Okay. The middle inserts in the acromion, and the lower inserts onto the scapular spine. innervated by cranial nerve 11. And what is the action? Well, the superior trap will elevate the scap and extend the neck here. The middle trap will retract and the lower trap will depress. Muscles of the eye. The extrinsic eye muscles originate outside of the eye of the skull. Each muscle inserts into the eyeball. So just make sure what you know the actions of each one, what each one does. Okay, so what does the superior oblique do? Superior rectus, medial rectus. This is the right eye. Okay, lateral rectus, inferior oblique, inferior rectus. So if we look at this, so here's what the superior rectus will do. It'll look laterally and up. Inferior rectus will look laterally and down. The lateral rectus will look laterally. Medial rectus will help you look medially. Inferior oblique will help you look medially and up. And superior oblique will help you look medially and down. So all those TikTok fans are using their superior oblique and inferior oblique when they're making those videos here. Okay. Muscles that lower the jaw. Again, you've got the pterygoids, lateral pterygoid. Is a very important muscle. We'll go over these a little bit more detail. You've got some muscles of the tongue, the hypoglossal, styloglossal. If I don't put an origin, insertion, nerve supply on these slides, then you don't have to know the origin nerve insertion. You just have to know where they are. Okay. You've got the stylohyoid, mylohyoid, omohyoid, sternothyroid, thyrohyoid. Again, they're named for a reason. So if you look at stylohyoid, goes from the styloid process to the hyoid bone. Okay, omohyoid, sternohyoid. Again, they're named for a reason, but you don't have to know the origin insertion of all these. Just kind of have a general idea of where they are. But you do have to know the origin insertion of all the ones that I put in this slide. So that way you know which ones to study more in depth. And here's some more muscles of the neck. You have levator scap, trapezius, multifidi, longissimus, semispinalis, and we'll cover these a little bit more when we do the trunk and the abdomens. Okay, good job.